One of the greatest advocates for homeless people in the States, who was an ex-patient himself, is Howie the Harp. Okay, they call him Howie the Harp. That was his street name because he played the most wicked blues harmonica you could ever hear. And he decided that that was his name after that. But so the is important. So Kate the Great is a woman who's a performance artist, and she does one of these one-person shows like Mark Twain, you know, these things that travel all over. And basically her most popular show is one that she does all over the world, and it tells about her experience as a mental patient, because that's what she was. She was in the hospital many, many times throughout Canada, and she's from British Columbia, by the way, Vancouver. Been homeless, substance abuse, the whole 9 yards. And so she tells this story, and on the one hand, you know, you get to points in the story that are just hilariously funny. You get to other points, you just cry. I mean, it's just very powerful. But there reaches a point toward the end of her story where she is describing this scene. And she's sitting in London Psychiatric Hospital in Ontario, which is one of the older bins in Ontario. She has been there many times before. And she's sitting on her bed, and she describes in painful detail the story of her. She's going over her life. She's ruminating about her life and what has happened to her. And she describes the trauma and the hospitalizations and the homelessness and the abuse and the substance abuse and the jail time and the fractured relationships with her family and the loss of everything that she had over and over again. And she's just ruminating about this, and you can see her getting, as she performs this piece, you can see her just getting more and more depressed and despairing. And finally, she sort of tries to snap herself out of it, and she says, well, I can't keep on dwelling on this. I've got to think about the future, she says. So she starts looking forward to her future. And there's this kind of silence, and she's thinking about her future. And then she realizes that her future is no more than more of the same of her past, that that's what her life has been, and that's where her life is going, and that there's no prospect for things to change. And so you get this little sort of flicker of hope as she tries to think about the future, and then you just see her sink again. And then there's this silence, and the silence is so thick in her performance you can almost cut it. And everybody is just sitting there experiencing her life. And out of this silence, her voice suddenly rises and swells, and she says, I choose to live, she says. I choose to live, she says. And that was the point for her, the spark of bottoming out, as we say in AA, but it was the spark of recovery. She'd gotten to the point where she was no longer willing to have her life go in that direction, and she was no longer willing to have other people control the course of her life. Okay? I choose to live, she says. She was never hospitalized again after that. Didn't mean she didn't do a lot of hard work to get to a place where she wasn't going to be hospitalized again, but she was doing the work. And she occasionally uses medication. She has a network of friends. She has 2 great cats. And she has a life. She makes a decent living as a street performer and a performance artist. And she chose to live, and she's alive. You know? And she had to get to that point of really things coming completely unraveled. But in that case, it came to her herself without, you know, without other people. So that's really what recovery is about, is nurturing those sparks in people, seeing any possibility of them and encouraging them and so forth, and really hooking people up in every way you possibly can with other service users who have been moving forward in that process so they can learn about it. Okay?
We want to talk to you about a research project we have been involved with. The research project is sort of jointly owned by 3 of us, but Barbara is the principal researcher. For a long time, I have been personally interested in the concept of recovery and understanding it from the perspective of a consumer. So when I was trying to set up this service and came across the nursing faculty at Queensland University of Technology, it was very nice to see somebody with more research and analytical skills who has been thinking about it for an equally long time. So the two of us got together and see how we can fool the system to get a research money. And we also found at the same time our colleague and my colleague Helen Glover, who is the consumer project officer in our service. So the three of us got this idea about trying to ask the experts, namely the consumer who claim they've had schizophrenia in the past, who also claim they're in recovery, asking them to tell us about what the journey of recovery was all about. And as the principal researcher, Barbara will do the principal work of this afternoon.
Which means most of the talking. You've got an outline of the workshop and what we're going to talk about today, and so I won't go through and read that. So I'll just start off talking about the concept of recovery and going over some of the literature before I get into our research. What I'll be presenting is, when we get onto our results, is the analysis of data from 42 people that we've spoken to so far. And it's still work in progress, so these are not definitive results. If you look at the concept of recovery from schizophrenia, certainly for people who have done any sort of work with this area, they come across the notion of, is there recovery from schizophrenia? Certainly there is the two views about that. That is, if you recover from schizophrenia, then you were misdiagnosed and never had schizophrenia in the first place. So therefore, it's not recovery from schizophrenia. So you have to go through that debate, and clearly if you look at the literature, there is recovery from schizophrenia. If you remember Carly's overhead this morning, he was talking about those longitudinal studies that have been done from anywhere from 27 years to 37 years that show at least a 40 to 60% significant improvement rate for people who have had a diagnosis of schizophrenia. So clearly there is one, but we have to deal with that argument of, well, these people were misdiagnosed and never had the disorder in the first place. So in terms of a research project, that has significant implications, because you then have to make sure when you're talking about this to convince your audience that the people that you are asking about their recovery from schizophrenia actually had the diagnosis in the first place. And what we have done in that is we are using the SCID, the structured diagnostic interview, from